Hello, everybody, and thank you for tuning in. This is part of a webinar series where we have discussions sponsored by No Rare, and we're focused on myositis this month because it is Myositis Awareness Month in May. So I'm really excited to talk with our guest, Lindsay, and learn about her story, Diagnostic Odyssey, and she is such a kind and open person. So thank you, Lindsay, so much for coming on here, and you're going to be sharing your perspective as someone that had their world changed by a diagnosis of myositis. So thank you for coming on just ahead of time and being so open, because this really is going to resonate with a lot of people.
Well, thank you so much for having me. Every journey has the good, the bad, the ugly. And one of the things that I have found to be very therapeutic has been sharing my story, because had I had somebody to turn to in those early days, I think it would have been a much better journey.
I can imagine. And so much of what we like to do with these webinars is to highlight people's stories and their processes through that, because then people don't feel as alone. So other people watching this that may have myositis or another condition that's similar, I think there's so many things that symptoms or even just that diagnostic odyssey, that part will really resonate with people. And to kind of start us out, I mean, myositis is not a condition that is top of mind for a lot of healthcare providers and doctors. It is rare. So unfortunately, a lot of rare conditions that applies to. And that the symptoms are somewhat generic from what I understand. And doctors will think of other more common diseases, which makes sense in terms of a diagnostic list and figuring out what is in that criteria, what should we be thinking about. So to fill people in, what were some of your initial symptoms and some conditions that were originally on that list of what condition could be behind this, or what could have triggered some of those symptoms that came up for you?
Well, with my journey, hindsight has been a gift because my journey with my diagnosis is a little bit different than most people's, in the sense that I contracted an infection while hiking in January of 2023. I got cellulitis in my leg, and we now know that that infection was fuel to an already burning fire, meaning the dermatomyositis was kind of taking over my body, but in a way that wasn't very noticeable. And a lot of the symptoms were masked by the fact that I was very active. I was working out 4 to 5 times a week. So this muscle fatigue and muscle weakness and soreness and stiffness really could be related back to so many of the things that I was doing in the gym. I was doing a lot of strength training. So it made sense that things felt, tight and sore. And I'm not getting any younger. It's like some of those things that you would have maybe in your 20s been like, oh my goodness, like this is not normal. But as a 30 something woman, I was like, oh, I mean, I'm getting older. Maybe this all is just a part of the process. But this infection in January, I was on a hike. I got some cactus spines in my leg. And as I mentioned, was really just fuel to an already burning fire. And I know now that I present very differently than a lot of people who have dermatomyositis who deal with muscle loss. And you mentioned it's Myositis Awareness Month. One of the things that I just learned the other day is that not every person who has dermatomyositis suffers muscle loss or suffers from muscle weakness. So every person's diagnosis is incredibly different. I had a friend who has a son who has a rare disease, and he pointed out that it's kind of like, it's not that I have dermatomyositis, it's that I have the Lindsay Guentzel disease, because my dermatomyositis is going to be different from every other person that I stand next to. And that was what was really challenging, I think, for my medical providers in finding an answer. And so one of the things that I think, I show people this all the time because it is just such a drastic viewpoint of what was happening. I go on this hike, I get this infection every day for about 2 months as they were trying to figure out what was going on. And again, they're pumping me full of antibiotics and steroids and thinking like, oh, it's just cellulitis, it'll go away. But I was waking up looking like this.
And that is a very intense image. I mean, your eyes are swollen, your lips are swollen, you don't look happy. I mean, that is so different than how you look right now in this video.
Thankfully so. It would have been one thing to get this rare disease and then to continue to wake up looking like that.
Sure.
And I was lucky that it was a 2-month stint. But it really confused people. They sent me to the dermatologist. The dermatologist kept saying like, oh, maybe allergic reaction. On the back end, I'm researching cactus scientists and sending them emails. Like, I'm convinced it is this cactus. This cactus has made me this way. I've got to figure it out. There's got to be a solution.
That's what happened that triggered, kind of from your viewpoint at that time. All right, this infection happened. It's got to be related to that, because that's the only thing that's really different. And as a journalist, of course you're reaching out to people. You're pulling from those skills of being resourceful.
You also feel helpless. You feel like, okay, you get an appointment and it's 2 weeks out or a month out. And in that time, you are Googling whether you want to or not.
Nah.
And so I was going down these rabbit holes of what could it be. I thought, oh, it's the cactus. And then I was having artificial nails put on at the time. And I thought, oh, maybe it's an allergic reaction to that. All of these things. And it's interesting, so this is like winter of 2023. And I was diagnosed officially in March of 2023. So we're over a year past my diagnosis. And I still have people asking me, so was it the cactus? And I have to like rewind and be like, it was, in the sense that it just brought my symptoms to the forefront. And I'm really grateful, because had that not happened, I don't know how much longer I would have continued to kind of skirt under the radar, because we can look back and see some of the symptoms popping up in like November of 2022. So months before the hike. And it's really scary to think I would have been just kind of chugging along with those sore muscles and not sure what was going on. But I had this moment of, okay, you got sick, your body is in turmoil. And that led to going to dermatology. And those blood work results sent me to the gastroenterologist. And the gastroenterologist behind closed doors was reaching out to rheumatology and was like, something's off with her liver numbers. These enzymes aren't right. What should I be looking at? And then they ordered the CK levels. And when my blood work came back, my CK levels were about 7,000, keeping in mind like an average person's range around 300. So my muscles were incredibly inflamed. We'll have no idea how long they'd been that way, because we only have numbers starting in, winter of 2023.
You don't have a baseline of when you didn't have any symptoms, because why would you, right? Exactly. For most people, you're seeking those types of tests when you already have issues. But helpful to know what the baseline is in terms of just a normal level of someone that's not experiencing these types of symptoms. But yeah, a few hundred versus, what did you say, 7,000? I mean, that's 7,000. Literally off the chart.
Off the charts. And I'll put it into perspective for you. So I wasn't hospitalized until my CK levels were 21,000. And that was because they were concerned about my kidneys. All of the people in my life who work in healthcare, every time I post about my CK levels, the immediate response is, how are your kidneys? My kidneys have been champions. Like, they are going to get
they're the real MVPs in the story, right?
Yes, they are. Absolutely. But going back in those moments, you have no idea. I had no idea what CK levels were. I had no idea what my ALT and AST liver enzymes were. And you just get this crash course in medicine for something that is so rare. And as you mentioned, so few people know about it. And then you're expected to become an advocate for yourself. And that part is really, really challenging, because you're dealing with the grief and the sadness of it all, and then expected to like put on your bravest face and fight every single day.
And teach yourself all of this. And you're someone that comes from a background of journalism, as I said, where you are constantly, all right, this new topic, I need to learn enough about it to interview someone, to write something. You have a radio background. If you guys can't tell, that's where the skills are coming from today. And so you were kind of prepped with a lot of these skills to do this, but not everybody comes from a background where they are pulling from those experiences. And you're having to learn all of this at such an emotional time when you're also having a lot of physical symptoms. And I think that's what so many people in the rare disease community experience, whether they are a caregiver and learning this and really worried about their loved one, oftentimes a child, or when people are having the symptoms themselves and having to experience this. So when you received this diagnosis, and it was a correct diagnosis finally, because a lot of people go through, those first 1, 2, something like that is usually incorrect, or it's a working diagnosis. They're like, we think, which was kind of the case a few months after the hike, it sounds like. What was your process in terms of your healthcare provider saying, okay, we have this diagnosis, now what? What does that treatment plan look like? What kind of questions and worries did you have at that point?
Well, you'll appreciate this. I got the phone call, I think March 7th, and March 8th, I was set to fly to Austin to host my first panel at South by Southwest.
Oh boy, that is a huge
yeah.
conference that for
Yes.
people that aren't in the podcast and media space. Yes, huge.
Yeah. And all I worried about was him giving me the okay to fly. That's all I was concerned about. I had worked so hard to get to that point, and the last few months had felt so overwhelming. And I was actually presenting on mental health and entrepreneurship, so it felt like this really perfect moment. So he calls. My antibody panel had come back. We had confirmation on what antibody I had, which led to more of a formal diagnosis. And he gave me the green light to go. And I told myself, you're going down there and you're not allowed to Google anything. You are not allowed to go down there and catastrophize your life. And it was very hard, but it was so refreshing. And I actually was very proud of myself because I was able to do it. I was able to go down there and just, be in the moment, because it's very hard. My mobility was very different than it had been even just the month before. I was very weak. I had a very hard time doing things on my own, getting onto the airplane, all of those things. And it felt like this challenge I had to undertake. And then we got back and it was immediately into treatment. And we just jumped in. And one of the things that I think if you've never dealt with a rare disease is very hard to comprehend is that a lot of the times, especially for something like dermatomyositis, where nothing right now has been created on label, everything has been created off label, meaning it was created for something else, and they have found ways to use it for the disease that I have. It feels like you are just throwing things at the wall and seeing what sticks. And that really is what's happening, because that's all there is. And it's wild to think, you're on medication and there's great results from a clinical trial of 15 people. And that's considered incredible. In this realm of rare diseases, you are looking for those moments where they can say this was really successful for this tiny group of people. But the CDC estimates that there's 5,000 people who live with dermatomyositis in the United States right now. So 15 people is a good
That's
chunk
a high
of us.
end number for a rare disease study.
Yes.
Yeah. Yeah. I mean, I think that's something that is so challenging, like you said, with the off label. And it's maybe a condition that is more frequent or at least more well studied, where we're like, okay, this medication has helped for this symptom of this disorder. Do you have that same symptom? Well, maybe it will work for you. But that's tough because it is a guessing game and it's trial and error a lot of the time. Did you have a lot of that with treatments where you tried something, didn't work? All right, let's try again. What were your frustrations around that?
It's very sad because we expect results immediately and you feel like you've wasted time. So there's that part of it where you already feel like your life is put on hold and the things that you wanted from life aren't as much of a guarantee as they felt like they were before you got sick. So you're dealing with all of those emotions, and then you're putting your trust into medications that have worked for people. You know that they've worked for people. I see in the support groups that I'm in that these have been successful for people. And then they're not successful for you. And I think the biggest one for me was actually a major setback. So CellCept is something that has been used for a lot of patients with myositis. It was originally created as a drug for people who have had organ transplants so that your body doesn't reject it. My body went into full-blown panic, and I had what's called paradoxical acute inflammatory syndrome, and it set us back about 6 months. In fact, we're still dealing with the ramifications of testing out that medicine. And my rheumatologist, bless his heart, because I was an armchair doctor one weekend. It was like a week after I had started it, and I felt awful. And I'm doing what I did when I was researching cactus scientists, and I found a black box label from New Zealand. And I'm reading the symptoms, and I'm going, God, this sounds so familiar. Like everything matches up. But there's also this part of it that is hard because you're taking a new medicine and your body is responding in ways. And some of those symptoms also just show up on the symptom list. And some of the symptoms are also symptoms of the disease you have. So you're trying to separate all of those things. But I sent him a note and I just said, I think this is what's going on. And he did the due diligence and compared all of my blood work to the one documented case that they had in rheumatology of this happening ever. You know, I joke that I wanted to be special in life, but like this
Not
is
this
a little
way.
much.
No.
Yeah, it's wild. And it's hard because everything takes time. And, you know, what I'm working on right now is reminding myself that if I walked out into traffic and I got hit by a car and I broke my leg, I wouldn't wake up the next day being better. It would take months and then probably more months of physical therapy and letting your body acclimate to this new normal. And because I've been sick for so long and so much has felt like it's been put on hold, it's very hard to give into that time frame and go, you know, if someone had cancer, it wouldn't be a shock that it took them 3 years to fight and to feel better and to kind of get back to what they consider like a quote unquote normal life. Why am I putting so much pressure on myself? And I do think a big part of that is because no one understands what I have. And so when you explain the symptoms and you talk about the hardships, it's so much different than if I did just have cancer and they can go, oh, I get that. I've seen people who have had that.
Yeah, of not being able to say, oh, well, my aunt has myositis, of being able to pull from that, whereas everybody has someone in their life that has had cancer and gone through treatment, right? Who hasn't? So it is that familiarity, which is challenging. And oftentimes people will be like, well, it's similar to this condition or something that's more common.
Yes.
I mean, now that you're a little bit further in terms of, you know, understanding you have this diagnosis and trying out different treatments, how has your life changed in terms of, let's put it, you know, a couple months after the hike with the cactus incident, I suppose we can call it, and where you were then versus where you are now? I mean, you look very healthy, which is also sometimes a challenge because people are like, well, you look fine. But what is life like now, especially with the treatments that you're on? I mean, it's a constant readjustment. So I don't want to allude that, oh, everything's good now. But how is it different?
You're right in that it's a constant readjustment. So right now I am taking more pills every day than I had probably taken in my entire life. I actually just started a new medication today. So I'm adding in methotrexate. So I'll take that once a week. And you know, you're standing in the pharmacy aisle and the pharmacist asks, have you taken this before? And no.
Yeah.
So we go over everything and she says, you know, people report being really tired. And you're like, oh, great, more of that.
Right. You're like, that's one of the symptoms I'm trying to ease. And now you're like, I'm faced with more of this. And it must feel like one step forward, two steps back in those moments.
Absolutely. And, you know, when I was diagnosed, I felt like I was really coming into my own in my career, in my relationship. It felt like so much that had really been pulling me down years before were things that I had worked through. And then came this big monster. And, you know, I joke that I'm the cliche of the person who got the life-changing diagnosis and really was able to put things into perspective. And I say over and over again, I hope that everybody gets that in a much less dramatic fashion, because having your life changed by something that there's so little known about is very overwhelming. And, you know, some days when I am not in a great place, my brain goes, I wonder if that was the last time I downhill skied, or I wonder if that was the last time I went for a hike. And so you push yourself to do things that you physically could do before, but at a much different cost. So like right now, physically, I've lost probably 25 pounds of muscle since I was diagnosed.
That's a lot.
Yeah.
That's a major amount.
Yes. And a lot of the things that I used to love physically, running, swimming, going to gym classes, strength training, you know, I'm working on coming to terms with the fact that as a woman who had spent the majority of her life hating her body, that I had started to come to terms, and it was actually being really kind to my body right when I got sick. It's kind of like that cruel moment of all of those feelings of hating myself and being not kind to my body. I had worked through them in therapy and in so many different ways, and was really loving how strong I was, and wasn't paying attention to the number on the scale. And now I pay attention to the number on the scale because it just continues to go down, and not in this healthy way, in like a concerning way.
And losing muscle, not losing like fat that someone is trying to shed.
Exactly. Yeah.
And it's so hard because I think a lot of, other women and, a lot of people experience that in terms of just as we grow up, of like puberty is so hard, of just our bodies changing. Socially, it's hard with all that. And then you kind of get into your 20s and you're trying to find your rhythm with feeling good about yourself and exercising and eating. And then, I'm not quite there, but I'm looking at my 30s coming up, and I'm sure it's like, okay, I've heard 30s is like, oh, it's so much better than your 20s in so many ways of just feeling your life's more stable and all of these different aspects. And then to have this thrown at you at such a young age of like, I'm in my prime, I'm in my 30s as an athlete, and everything that you have going for you, that is just so challenging to have that thrown at you, as opposed to later in life when you're like, yep, part of the aging and part of, okay, yep, it's going to be harder for me to do that mountain I did 2 years ago.
Totally. And the other part that you have to take into account is we don't know the long-term ramifications of all of the medications that I'm taking right now. Yeah. So it's like I'm putting in all of this work to live as best of a life as I can, but at what cost, further down the line. And so, man, getting on that path and sitting in that rocking chair is a place I do not like to go, because no one wants to think about death, but it's a lot more, I think, damaging to our personal psyche when we're thinking about the fact that the life we want is not necessarily on the table any longer.
Yeah, that is a challenge of just having this be something that's coming up for you much more than someone that is not diagnosed with a rare disease, and being faced with that and looking at studies to have that information. Can you talk a little bit about your relationship with your rheumatologist and maybe how that's helped in terms of just learning about how this could affect you long term? Because some of these medications are well studied, even though it may not be well studied in terms of this off-label use.
He's the best.
Yeah.
Like, I honestly just...
I was hoping you would say the fact that you mentioned them earlier. Yeah.
Yeah, I just feel for so many people in the community who don't feel supported. I have been so lucky that every question I have, every issue I have is responded to with urgency. He jokes, Dr. No, shout out Dr. No, that he made a list last summer when I was going through a major flare-up and was hospitalized, and there were like 5 patients on there, and we all have, different diseases, and everyone is off that list except for me. And he said one day, he's like, you keep me awake at night. And every time he comes in, things just get worse, and he apologizes, and it's like, it's not his fault, but to like know that someone is pulling for you, because it can feel so isolating, the healthcare system. They're all doing their best, but they're overworked. And, one of the things that I really am grateful for was, I mentioned that gastroenterologist who behind the closed doors was asking questions, because had they not pulled my CK levels, my first rheumatology appointment wasn't until July of 2023. And so this was March of 2023.
Wow, months later.
Yeah, and those numbers came back, and that was really what moved me to the front of the line. And it's nice to have that connection with him and to trust him and to feel like he has my best interest at heart. Because as I mentioned, like, I see other people who don't have that. And I don't know what this journey would be like if I didn't feel supported by my medical team.
It's so important to feel like they are listening to you, because there's so much information that had you not provided, I have been feeling more sore, but I'm an athlete, blah, blah, blah. Like, the context, I think, is really important for a lot of this, especially for someone that is young and active and healthy of, all right, well, we got to piece all this together, not just you came in for this symptom, okay. Having that holistic approach is so important, and to have someone that's like, I'm researching, I'm invested in figuring this out with you, and that collaborative approach that you're really talking about. I know from the patients that I'm also a healthcare provider, and so having that connection, I can feel on the patient side, and oftentimes patients will say like thank you for taking the time to do this and that, and I'm like, let me know, like give me an update, let's, here's my email, like just being able to approach in that way and not just like, okay, Lindsay, can you confirm your date of birth? Yeah, and what are you here for today? Like not having that approach, right, of being so different. One thing I wanted to ask you about before we ended is I'm learning a lot more just working with No Rare about clinical trials. Is that something that you would consider looking more into, especially as someone that, is really good at researching on your end of if there are clinical trials available that are a match for you, because you still are figuring out medications. It's not like I'm on this cocktail of meds and this kind of setup and these appointments and it's going well and I want to keep it the same. You're still figuring it out.
Yes, absolutely. One of the things that I've said from the beginning is all steps forward for dermatomyositis benefits all of us. And so clinical trials are so important in adding to that. Right now, what's really tough is that I have been in this flare since August. And so as I mentioned, my CK levels when I was hospitalized were 21,000. Like right now, they're still above 16,000. And so we're at this place where we're trying to get things under control. And then we're going to kind of look around and see what's going on. But one of the things I do really appreciate about my rheumatologist is he brings up clinical trials all the time. He's very on top of what is happening. One of the medications that I'm actually on right now is is still in clinical trials at Johns Hopkins. So they're looking at that. And, I think what's hard, and it's why I love the work that No Rare is doing, is the executive function it takes to be chronically ill and to have a rare disease. It is exhausting. And some days doing the bare minimum to keep yourself in the front of the line, to keep medication, on your table, to make sure that you're taking the right steps forward is all you have. Finding a clinical trial and getting in a clinical trial takes so much work. And I think for some people, it's just an avenue they're really unfamiliar with. And I think that there is the fear factor. There's the fear factor of, well, everyone thinks there's only one kind of clinical trial. There's this idea where you either get the medicine or you don't. And obviously we know that there's much more nuance than that. But I think for a lot of people, it's kind of this fear of the unknown. And again, that added layer. I'm already doing all of this work. There's going to be so much more for me to undertake here, which is why what's happening with No Rare and the connections that they're making and really leaning into trying to make that ease for the patient, taking one thing off of someone's plate. It's what I say all the time. Like, I don't care what it is, what you do, taking one thing off my plate every day is so helpful. And I think the more we explore rare diseases. And I say that kind of for myself. I am 14 months. Well, no, gosh, I'm January 2023 was when I first got sick. So I'm 15, 16 months into this journey, and I still have so much to learn. And a big part of that is going to be how will clinical trials play a role in the future for me? Because the great news is that more medical companies are looking into developing medications specifically for dermatomyositis, and they're going to require clinical trials. So all of the good news that comes out, all of the research that's being done, all of the, studies we're seeing about, T cells, all of that is going to have a phase where clinical trials are going to play a role. And so you just really have to be open to it and working on kind of that acceptance, but also doing it in a way that makes you comfortable with a group of people who makes you comfortable, I think is a huge part of it.
Oh, it very much is. And I think I love how you phrase that of how will clinical trials have a role in your future healthcare, because you will probably be in multiple clinical trials, right? I mean, realistically, there's going to be different opportunities for you and to be connected with even more amazing providers that are experts in your type of myositis and, the Lindsay version of it, right? As you said, that everybody's so different. And that's the case for a lot of rare diseases, especially autoimmune rare diseases. I think I've just heard that so much. So, Lindsay, Thank you so much. I mean, you are just such a light, and I just so appreciate on behalf of Rare and people listening and watching, just being able to hear your story. And they can hear more from you because you're also a fellow podcaster. Can we plug your podcast? What's the name of your show? You talk about your ADHD diagnosis and what you've learned from that experience. Am I getting it right?
Yes. So I produced the podcast Refocused for about 2 years.
What a perfect name. Like, amazing.
Thank you. Yes. No. And it was a life-changing project. And honestly, most days through the rare disease diagnostic process is really what kept me going. And I'm working on shifting kind of my thoughts on that project, and I'm going to take the summer off because I worked through 3 hospitalizations, and someone mentioned they were taking the summer off, and I was like, oh gosh, you can do that?
Yes.
I can take the summer off and rest and refocus my plan.
Refocus.
I like that there. Thank you. But no, I've really enjoyed diving into that. And had I not been diagnosed with ADHD, oh my goodness, this last year would have been a disaster, because I saw a statistic in my chart, and this isn't from just when I was diagnosed, but this is probably only from early 2021. In the 414 appointments I've had at my provider, I've missed 3% of them. And as somebody who would have missed a lot more had I not been aware of some of my executive function setbacks, I was very proud of that statistic, because I was told that
amazing.
Most people are
400 appointments. Yeah.
Most people I heard are in like the 30%. So the fact that I had 3%, I was like, yes.
As someone that has no shows for patients, yes, I would agree with that. Yeah, no, definitely. But yeah, I hope everybody checks out Refocused. I think that's amazing. You're such a natural podcaster. And I just really appreciate you sharing everything. And for people that want to learn more about myositis, we're going to be continuing talking about myositis for the Awareness Month here in May. And we're going to be talking more about myositis treatment and research with Dr. Aggarwal in our next webinar. So we're really excited to be talking about that. But Lindsay, thank you so much.
Thank you so much for having me. This was great.